This week's edition of NJBIA's Minding Your Business is brought to you in part by AT&T, helping family, friends, and neighbors connect in meaningful ways every day. From the first phone call 140 years ago to mobile video streaming today, AT&T innovates to improve lives. New Jersey's community colleges, aligning education to build an innovative workforce. Find out how your business can join and benefit at njpathways.org. And by New Jersey Business Magazine, providing the critical information needs for New Jersey's business community for more than 65 years.
Welcome to NJBIA's Minding Your Business. I'm your host, Bob Considine. Well, Capital Health has been known for providing quality health care in central New Jersey and Pennsylvania. But more recently, its virtual primary care program has been successfully treating patients from the comforts of their own homes. Here to talk about how these 21st century house calls work are Dr. Jerrold Gertzman and Dr. Stabile from Capital Health. Gentlemen, thank you so much for being here.
Thanks for having us.
All right, so before we get started, I do want to read your credentials because Lord knows you earned them. Dr. Jerrold Gertzman is a board-certified family medicine physician at Capital Health Primary Care in Lawrenceville and also serves as the medical director of Capital Health's Primary Care Network. And Dr. Michael Stabile is the board-certified family medicine physician for Capital Health Primary Care in Hamilton. Gentlemen, thank you so much for being here. Before we get to virtual primary care with Capital Health, I was hoping we could talk a little bit more about Capital Health in general. How much ground do you guys cover?
So Capital Health has had physicians in the community for over a century.
Mm-hmm.
But we have Capital Health Medical Group for the last 7 years, which was an organization within Capital Health that sort of put all of the employed physicians under one umbrella.
Right.
So we have 20 primary care offices in 3 counties in New Jersey and out in Bucks County, Pennsylvania. And we have dozens of specialty offices in and around Mercer County and in Bucks County as well.
Right. And like 500 physicians and clinicians, right?
Exactly. So over 500 physicians and nurse practitioners, physician assistants in the entire medical group, about 85 primary care docs, and the rest are either specialty physicians or are hospital-based physicians.
Got it. So primary care and specialty care, great stuff. So let's talk about the virtual primary care at Capital Health. This is essentially a telehealth program, correct?
I'll let Mike answer that question.
So exactly. So this is a telemedicine program that we have started that is essentially a subset of our primary care network,
right.
Specifically to offer telemedicine service through our patients as well as patients in the community.
Right. What kind of healthcare are we talking about here?
So we are geared towards acute medical issues, so issues that are new and not chronic medical issues that are being managed by the patient's primary care provider. So any kind of new concern or any issue that patients have that they want to have a detailed discussion with a physician or provider, we're available for that.
Okay. Was this something that COVID-19 kind of kicked into a new gear for the...
Yeah, we had dipped our toe in the pool of telemedicine long ago.
Right.
So we were well prepared when COVID hit.
Right.
We were able to pivot pretty quickly and convert to telemedicine when people didn't want to leave their homes. People were afraid to go to the doctor's office. So we converted to telemedicine pretty quickly for that. And we were able to evaluate and treat a lot of COVID patients early on. But it really did a great service for us and for medicine because people and physicians and providers who were afraid or not convinced about the role of telemedicine, we all became believers.
Right. Let's talk about that. Let's go on the, skepticism if patients have any. What is this? You mean you can treat me without seeing me? Do you meet that, and how do you respond to it?
So that is something we see periodically. I actually have been surprised as we have further implemented more telemedicine within our practice that a lot of people really have taken very well to telemedicine. and they are very appreciative of the convenience that it gives them, and the ability to see their doctor, in the convenience of their own home at a time that is convenient for them. So it really has been a great transition to allow our patients to have that capability.
Right. I'm wondering, in certain cases, maybe less exposure to germs for an acute situation. Is that even a consideration?
Yep, absolutely. And particularly with COVID, obviously, that's been a huge concern. So people who have COVID, or they have some kind of illness that maybe they shouldn't be in the waiting room, or, we can at least assess them initially to guide them in the best direction for their care. It's great to have the ability to be able to do that assessment through the telemedicine.
All right, very good. Can telemedicine ever help folks avoid an emergency room or an urgent care facility?
Absolutely. I mean, we can assess almost any medical problem by telemedicine. We may tell you that this requires further evaluation, and we want you to either be seen in an office or go to an emergency room. But we can provide care for almost any problem, or at least an initial evaluation.
Right. I'm wondering if doctors like yourselves, do you have to go through any specific or different training to perform telemedicine? Is there something you guys have to learn that's new?
So within our training, there was not specific telemedicine component of that. The majority of our providers who have trained over the years, this was never an included component of their residency. That's beginning to change, and residencies now are incorporating telemedicine within their training, but formalized training we didn't have. A lot of the ability to be comfortable with telemedicine was just kind of learned doing telemedicine. And when we first started our virtual practice, we were able to give our providers at least some tips and tricks on how to create an environment, a virtual environment with lighting and things you don't always think about with the computer, because it is a little bit different than how we usually practice, as well as just ways to do a physical exam virtually, obviously different than in person, and how to manage things via telemedicine. That's maybe just a little bit different than what we were initially trained and were used to doing. But a lot of our providers really caught on very quickly and were able to make that transition very well. And so it's really been great.
I'm wondering if you guys actually have a preference, both of you can respond to this individually. Do you actually prefer performing telemedicine versus having somebody come in?
For me, I think there's a role for both. A lot of times you really do want to connect with that person in, face to face. Right. And a physical exam is important, although there is a lot that can be done without an actual physical exam, touching with my stethoscope. For example, you come in for your physical and you haven't had your labs done. I'd really like to talk to you about your labs face to face. So I would schedule a follow-up telemedicine visit. So you don't need to come all the way down to the office and have a whole other visit, but we can connect on the video and then really impart some information that way.
What about you, Dr. Stabile?
Yeah, telemedicine doesn't replace an in-person visit. It's not something that you can just only see your provider via telemedicine and never have an in-person examination. But certainly there is a role for, like Dr. Gertzman was saying, follow-up of labs or evaluation of a medical issue that doesn't really require an in-depth physical exam. So I really like both aspects of that within my practice now.
And there is a lot you can tell by looking at somebody. It's not the same as talking on the phone. You can really tell a lot by seeing somebody in their home and the way they're acting, the way they're moving, the way they're talking with you.
Yeah, and you have to be that perceptive to actually look for it while they're talking to. Are there monitoring systems involved in telehealth at all? And does that help with your engagement with the patient because you can get information more readily available, I guess?
So there are ways to monitor various aspects of medical health at home. And within our medical group, we are trying to incorporate more of that. And we are doing some testing as to what might be most applicable to our practice. So, as telemedicine grows, there's going to be more and more opportunity for these home monitoring type of systems, and we are going to incorporate more of that into our practice.
Yeah, Capital Health Medical Group is really trying to stay ahead of the curve, and we've been pretty good about doing that. So we're instituting a remote patient monitoring program where patients can get blood pressure cuffs and bathroom scales and glucose monitors for diabetes, and even a pulse oximeter and different other devices to monitor at home and remotely, so we can get that in real time. So that will eventually be incorporated into the telemedicine practice, but for now it's really just becoming part of the primary care offices.
I'm also wondering, we talked about maybe skepticism from a patient, and I'd rather see in person, but I'm wondering if there are patients who actually much more prefer telemedicine and they don't want to ever see you in person again.
I would say absolutely. There are people that they are thrilled that they can see a physician in their home at a convenient time and not have to drive to the office and take time out of their schedule just for commuting and planning that. And some patients are just more comfortable not speaking to someone in person. So it does give a lot of people a little bit better feeling when they're talking to their provider.
Yeah, absolutely. I would imagine in the comfort of your own home, you feel good. I was reading somewhere people like they've done telemedicine while drinking a beer. I'm like, well, that kind of defeats the purpose. What about for children? Is there a certain age limit where telemedicine does not go?
Well, we have both internal medicine physicians and family medicine physicians, and family medicine physicians are trained from babies up to geriatric patients. So if your doctor is a family medicine doctor, you can absolutely do telemedicine for your child.
Got it. And what about preparation for the patient at home? What do they have to do to prepare for a telemedicine visit?
Well, it would be important for them to know all of their medications and their medical history.
Right.
When we are getting patients ready to see their physician via the virtual practice or within our group, we have a check-in process where we're able to update that information in our computer system so that when the provider is actually seeing them, they have the up-to-date medication list and their medical history. And if the patient is already a patient of our practice, we have their entire medical chart and medical history, which we consider a huge benefit for the patient as opposed to them going to an urgent care or utilizing another like national telemedicine company where they don't have access to those records. So, we really have the luxury of being able to see medications, last visit for a regular follow-up, or were they in recently for the same medical problem, because that can really change how we manage or think about their care.
All right, very good. So last question I'd like to ask is, how do you see telemedicine unfolding for Capital Health going forward? What kind of advancements could we possibly see?
Well, telemedicine is definitely here to stay.
All right, it's not going anywhere.
I think easily 20 to 25% of all visits can be accomplished through telemedicine. Follow-up visits, acute sick visits, and other just normal visits that you don't have to really go in and be seen by the doctor, whether it's a medication follow-up or a lab review, test result a review with the patient. All of this can be done by telemedicine. So I think that it's here to stay, and I think that's about the level you're going to see it continue. But I think the changes that you're going to see when we institute remote patient monitoring and other devices that can be used at home and connected to our telemedicine system or our electronic health record, we're going to see a lot more of that monitoring at home. Capital Health is talking about hospitals at home or post-acute care, and when you get discharged from the hospital, perhaps you don't have to go to a nursing home or a rehab. You can go home if we have these monitoring capabilities.
Right. Oh, that's huge. All right. Well, this is Capital Health's virtual primary care program. For folks who want to learn about it or Capital Health in general, they can go to capitalhealth.org. That is capital with an A. Dr. Jerrold Gertzman, Dr. Michael Stabile, thank you for both for being here today.
Thanks, Bob.
All right. And we'll be back right after these words.
You're first. First to respond. First to put others' lives before your own. And in an emergency, you need a network that puts you first, that connects you to technology and each other, that's built with and for first responders. FirstNet, the only officially authorized wireless network for first responders. Because putting you first is our job.
Welcome back to NJBIA's Minding Your Business. I'm Bob Considine. Well, Governor Murphy's record high $50.6 billion budget is in the books for fiscal year 23, and with it came some good news and some bad news for New Jersey businesses. Here to talk about the budget and some key bills that went right down to the wire is NJBIA's Vice President of Government Affairs, Christopher Emigholz. Chris, thank you so much for being back on the show.
No, thank you for inviting me, Bob. I'm always happy to be here.
All right, so before we get into the nitty-gritty of all this, I have to ask you, budget time is such a hard time, both for you and for Chrissy Butis, our Chief Government Affairs Officer at NJBIA. How are you holding up, man?
That is a good question, and being 100% honest, there was a little bit of PTSD. I think I had to take a longer 4th of July weekend than otherwise needed, and it was good just to kind of step away from Trenton, not think about Trenton, think about the beach and fireworks and swimming and that sort of thing. Because June was crazy.
It's intense.
And unusually crazy given that it shouldn't have been, and I'm sure we're going to talk more about that, but this budget should have been probably easier than it turned out to be. But that's part of the fun.
Yeah. Well, we have a couch and a low rate in the back, so if you need it, we'll have it for you. All right, so $50.6 billion budget, as I mentioned at the onset. Something like 42% higher than when Governor Murphy first took office. So when you look back on this budget a week from now, a month from now, 6 months from now, what do you think? What's your mindset about this budget?
No, honestly, it's a hard budget to analyze. And I think you can best describe it as middling, mixed bag, and that if you were going to describe it on a 10-point scale, I'd probably give it a 5. And if I was in the legislature and had the privileged opportunity to vote yes or no, it would have been a tough vote. It didn't get to the 6, 7, 8 that was an easy yes. It didn't get to the 2, 3, 4 that was an easy no. It was in the middle. And I think what you can also say is it was a missed opportunity. Another middling, mixed bag, missed opportunity, those M words. But it's hard to criticize a budget for what it doesn't have. And there are some things that this budget has that are strong, but there are some things that we'd like to have seen this budget do that it didn't do. And so that missed opportunity, I think, is another good way to describe it.
All right, well, so, you like to be positive. Let's talk about the positives in this. We had I guess another record pension payment, full pension payment.
Full pension payment, second year in a row. And Governor Murphy deserves credit for this. Governor Christie started us on this track, and bipartisan, they both deserve credit. We had, for years, governors of both parties had not funded our pensions the way they should. And Governor Christie started us on a 7th plan that eventually became a 10th plan. And Governor Murphy followed that up and then doubled up on the 10th plan last year to get to 10/10, 100% of the payment that the actuary said we should pay in. And then continue that for a second year in a row in his proposal. And obviously we had enough money to maintain that. So that's a strong thing. And what I'm also very happy to see is, for a while, BIA talking about what do we do with the federal funds? What do we do with surplus funds? What do we do just spending in general to make this a pro-growth atmosphere in New Jersey? And we always kind of say there's 3 things you could do. If we're spending money on infrastructure, workforce development, or innovation, those are win-wins. They're helping employees, helping employers. They're going to eventually lead to more state revenues. And you see examples of, yes, I think they spent too much, but in that new spending, there's a lot of infrastructure, innovation, and workforce development that BIA has been kind of pounding for years that this is the right thing to do. And I think we see the legislature and governor kind of going in that direction, and we appreciate that.
Okay, and also a good part, I guess, to an extent, is a surplus, $6.4 billion?
The $6.4 billion surplus, and I'm glad you bring the surplus up. That fits perfectly into kind of middling range, where it's funny, it's one of the highest surpluses in our state's history. That's a good thing. And Governor Murphy deserves credit for consistently trying to have a little more of a cushion in his budgets than previous governors, both Democrats and Republicans, kind of skirted the margins a little bit too thin, and if something dire happened, an emergency happened, something unexpected happened, we could have been in trouble and had to make some cuts that we'd really rather not. So it's good to have a bigger cushion.
But recession coming too, not to interrupt you.
But it's funny, being cautious is good, having a cushion is good, but with that recession coming, I would like to have seen that 6 billion range be 8 or 10.
Okay.
And we had the cash to get to that range. There's a couple reasons we didn't.
Right.
Some I think are positive and some I think are negative. But we had this giant amount of cash infusion that no one expected. Revenues were so much higher than people thought.
Right.
We could have done certain things with that, but we got down to 6.
Yeah.
If we were at 8 or 10, and I always like to say, like, if you're a business, you want your eye on the prize.
Right.
The most important thing that could be happening is next year's budget. We're supposed to sunset the corporate business tax surtax.
Yeah.
Right now it's 11.5 because there's a 2.5 percentage point surtax that makes us the highest rate in the entire nation.
Wow.
I want that to go away.
Yeah.
That is my number one priority, but that is a next year budget issue. The thing that we could have done this year's budget is, because you can't do multi-year budgeting in New Jersey, it's 1 year at a time. The most responsible thing to do this year to make sure that sunset happens is having a big surplus.
Yeah.
We have a big one. I think it could have been bigger to, just in case there's a recession, just in case there's some unexpected drop in revenue that's not even from a recession, from something else.
Yeah.
We were able to weather that storm. I'd like to think that we still can, but looking out multiple year budget forecasting, maybe there's some reason for worry 2-3 years out, and is that enough reason for the legislature and governor to say, yeah, we're not going to let this sunset next year as it's supposed to in statute, and that would be devastating for businesses.
Yeah.
Because what we just saw also over the last week or so since our budget happened, Pennsylvania just cut their corporate tax rate. They were number 2 in the nation.
Wow.
We were the only station in the nation at double digits. Pennsylvania was right behind us at 9.99, just under double digits. And now they have a plan to basically cut that in half over the next couple of years.
Wow.
And that's our competitor. That's our neighbor.
Absolutely.
And that was number 2. And now number 2 is falling a lot. And that's also a state that people are looking at.
Yeah. I mean, you look. Pennsylvania is a softball throw from here. I mean,
Yes.
you can think about regional competitiveness. So hopefully that 11.5 eventually does sunset. It's not a good look, right?
No, not a good look. And so hopefully we still get there and we can allow that to go away next year.
Okay. One last question on the budget. I mentioned $50.6 billion. Such a huge increase since Governor Murphy's been governor. Is this sustainable? Will we see a budget next year that possibly goes down?
I don't expect it. Budgeting's weird. There is a natural expectation that appropriations are going and revenues are growing. Inflation happens, spending goes up, people are making more money than they used to.
Right.
When you have a job in your household, you think that your revenue is going to go up, your income's going to go up, but you also know that your kids' expenses, your mortgage, your property taxes, things are going to go up on the appropriation side. So there's that natural back and forth that happens. But so I expect the budget to be bigger next year. And we also have some reasons as we get closer to full school funding. We are at full pension funding.
Right.
There's reasons why we don't expect to see increases in appropriations as much as we did for the beginning of the Murphy administration when pension funding was going up.
Good point.
Now that we're at that plateau, it makes things easier.
Yeah.
But we just did a brand new property tax relief program. Sustaining that's going to be hard. Sustaining the pension, sustaining the school funding, all those things are important.
Yeah.
I'd like to think that if revenues at least go up a little bit instead of the massive influx of cash that we just saw, we can do all those things and allow the CBT to sunset. But it is a worry.
Yeah.
When you have a recession, we've been seeing a lot of revenue growth. Recession, you can expect a minor growth. We don't know if a recession is going to happen. I could expect one maybe sometime in 2023 to see revenues dip a little bit for a quarter or two.
Right.
That's something that we should prepare for. It's not a given. And you know what? We overuse the word unprecedented these days. It's become cliche.
Right.
But we use it for a lot, for a reason. That because of the pandemic, because of inflation, because of the workforce crisis. There's things going on in our economy, forgetting about all the cultural, social stuff going on in the world and international stuff. There's things that are going on that we've never seen before.
Right.
And so how does that play into what's going on in New Jersey businesses, what's going on in our state economy, our employment? How does that play into state revenues? No one really knows definitively. And so anybody projecting out has a hard time.
Right. Well, I'll use another word we use often, way too often. I'm going to pivot here. Kind of related to the budget, you had mentioned, I'd seen and heard that, there was very little for business affordability in this budget. Yet at the same time, there was talk of, or at least a bill, that would offer some relief for businesses from the $1 billion unemployment insurance tax increase that they're dealing with for 3 years. What happened with this bill?
So I appreciate you bringing up affordability, and it was a disappointment that we didn't focus more on business affordability. We've heard the legislature talking a lot about affordability. That's a good thing.
Yeah.
It hasn't come down to we're helping small businesses with their affordability, or corporations or manufacturers. They haven't seen that relief. And so one of the things that we were trying to push alongside the state budget was UI tax relief.
Yeah.
Understandably so, the Unemployment Insurance Trust Fund that basically pays everybody's UI benefits when they're out of a job was drained at historic levels during the pandemic.
Right,
That's what it's for.
Yeah.
And so it did its job. Most states in the nation have put their federal relief dollars, either CARES Act or ARPA funds, into this fund. I want to say it's probably to the tune of $16 billion around the nation of states putting it into this fund.
Right.
New Jersey has chosen not to. That was an ask that we've made, the business community's aid, we've chosen not to. Then we pivoted and we said, okay, if you're not going to do this, can you at least look at these column increases? Because what happens is, as the fund goes down, what then happens is there's an automatic trigger where payroll taxes go up.
Right.
And payroll taxes going up when we're in the middle of why unemployment has been so high isn't necessarily a healthy thing for the economy, but it is natural part of that roller coaster of with UI going up and down, unemployment going up and down. It's supposed to happen, but again, this pandemic used UI more than ever before. It's something that history's never seen. So the historic impact on business UI taxes, I think, makes sense to use some of that federal relief, which is one of the things it was called out for. And the majority of states in the nation have done that. So we were hoping to make sure businesses don't bear the brunt, because in a way, if you think about it, businesses are being taxed on the very shutdown that government made them go through. We can debate the public health reasoning for it, and the governor likes to say economic health is tied to economic health. Public health and economic health are intricately interwoven. That's true, and that's important, and we don't need to debate that, but we did have a longer shutdown than most states in the nation, and that means our businesses are going to see a bigger tax increase than most states in the nation. We should fix that. And so the compromise of a compromise, after we pivoted a few times, was let's give small businesses a tax relief that covers about 2/3 of their payroll tax increase. And thank you to the Assembly, passed it unanimously. Assemblyman Fryman, Majority Leader Greenwald sponsored the bill there. Thank you to Senators Madden and Gopal, who sponsored it in the Senate, passed the Senate Budget Committee unanimously. And then we've heard reports that the governor's office called these senators on the floor and said, I don't want this bill to get to my desk. Please pull it off the board list. We think it would have been a perfect complement to the budget, that the budget was a little light on the business affordability side. So here you're doing something to make small businesses more affordable, especially when it's something that other states have addressed already and we haven't. And so it goes to that competitiveness of other states care about business affordability. New Jersey needs to do more to stay in that race.
So we only have a few minutes, and I want to get to the teen worker bill, which you were instrumental in. But in wrapping up this UI bill, which you were also a major part of, do you think there's hope for it?
I think there's hope. I, as you said earlier, I try to be a positive, optimistic guy. Senators Gopal and Madden actually put out a release the day that it was held from the Senate floor, saying they got commitments from the governor's office to work on this in the fall. We look forward to that. We want to be part of the process and collaborate, come up with something. I hope it's not too small of a something, and we can come something that actually will make business more affordable and not tax them for something that wasn't their fault, but that's to be seen.
All right. Last one, Chris. This I mentioned, the teen worker reform bill. It makes permanent new working hours for minors and greatly improves the process for teens to obtain working papers. You were all about this bill. I know you work with the sponsors closely. How is this going to help businesses?
I think I like to describe it as a win-win-win, because I think it's going to help businesses. We're in the middle of a workforce crisis. We can't find people to work. One of the easier things we could do is we are more restrictive than most states in the nation with how much we let 16 and 17-year-olds work. So what this bill does is gives them a little more hours, gives them a little more flexibility with scheduling, and on top of that, it also updates the working paper process, which will make it easier for those 16, 17-year-olds to get jobs. Again, we were one of the more restrictive states in the nation, making those teenagers jump through hoops, their parents jump through hoops. You had to get a note from your doctor, your principal, like who else knows you had to get a note from? And so updating that, putting the system online with the Department of Labor, the employers involved. We worked with folks from the hospitality industry, amusements, restaurants, food stores, and everybody's going to benefit. And I like to say win-win-win, because the teenagers are going to get more money over the summer so that they can spend it over the year, go out to lunch with their friends and that sort of thing, go on the boardwalk. The employers can address the workforce capacity to some extent because they have a few more hours, a little more flexibility from the teenagers.
Right.
And it's going to help all of us, because when we're waiting online at the boardwalk, when we're trying to get on our favorite ride at Great Adventure or Maurice Piers or Jenkinson's, when we're at a restaurant that usually takes an hour and a half, but this time it takes 2 hours to eat, because everything's a little slow, because we're not seeing the amount of workers we used to see. So everybody's going to benefit, and we think it's a good thing. We're happy to collaborate with, again, it was Senator Gopal, Assemblyman Fryman worked with us to get this done, and they deserve a lot of credit for the help they've done.
Well, good on them, and good on you, Chris.
Okay.
And thanks for being back on the show.
Thank you, Bob.
All right, and thank you for joining us on NJBIA's Minding Your Business. We'll see you next time.